Okay, continuing where we left off. If excess acid enters the body fluid, then it's going to react with the bicarbonate portion of this equilibrium conditions of the bicarbonate buffer in blood. All right. And when it does so, it is going to push the equilibrium towards the left. And then if there's excess hydroxide or base entering body fluids, then it strips off a proton of the carbonic acid and it'll push the equilibrium towards the right. Okay. And that's how then the pH of the blood is maintained. Okay. All right. So excess acid, then equilibrium shifts in the direction of the reactants, that is towards the formation of carbonic acid, and then all that excess carbon dioxide, because carbonic acid breaks up into carbon dioxide and water, all that excess carbon dioxide can then be eliminated through respiration or expiration rather. Okay, if there's excess base in the form of hydroxide entering body fluids, then carbonic acid can grab that excess hydroxide and form the bicarbonate. Okay. So this is how, and then kidneys are also able to supply more of the bicarbonate ion. Okay. So anything which is too much in excess can then be taken into the kidney for store for in terms of need. All right. Okay. So this is how the blood pH is maintained with the presence of the carbonic acid and the bicarbonate ion. All right, the equilibrium between these two entities. Okay. All right. So if you look at this again, the Ka expression here, Ka is going to be products over reactants, so HCO3 minus times the H3O plus divided by the carbonic acid concentration. All right, so Ka is equal to HCO3 minus Ka is equal to H3O plus times the HCO3 minus divided by H2CO3, and then when you rearrange it for the H3O plus concentration, then Ka is equal to the acid times the conjugate base, which is HCO3 minus concentration. All right. So Ka for this H2CO3 carbonic acid is 4.3 times 10 power negative 7. All right, that's the Ka value for carbonic acid. Suppose the concentration of the acid was 0.0024 and then the concentration of the bicarbonate was 0.024. All right, okay. So basically you have the concentration is basically a 10 to 1 concentration. All right, I mean, sorry, a 1 to 10 concentration. So it's a 1/10 concentration here. The ratio is 1/10. All right, and that's what you have here, 0.1. All right, so the ratio of the acid to the conjugate base is 1/10, so it's 0.1. So you multiply the Ka by 0.1, and that's 4.3 times 10 power negative 8. When you take the log of that, it comes out to be 7.37. All right, so it's within the normal range of 7.35 to 7.45. All right, so that ratio of the acid to the conjugate base needs to be about 1/10. All right, in order to maintain the pH of the blood. Okay. So what happens if carbon dioxide level rises? All right. If you go back to that equation, if carbon dioxide goes up, then it's going to push the equilibrium towards the carbonic acid formation. All right. So carbonic acid is going to go up. And if carbonic acid goes up, it's going to push this equilibrium to the direction of H3O plus. So H3O plus is going to go up. So if carbon dioxide goes up, so does the H3O plus concentration. And when that happens, if H3O plus goes up, so will the pH will drop, all right? A high H3O plus means a big drop in pH, okay? So carbon dioxide rises, then H2CO3 will rise, carbonic acid will rise, the equilibrium will produce more H3O plus, and the blood pH will be lowered. This condition is called as acidosis, okay? The opposite of that, lowering of the carbon dioxide, would be high blood pH and alkalosis, all right? So both conditions are equally harmful, okay? And so table 11.1 summarizes the causes of acidosis and alkalosis and then the treatments, all right? So some of the symptoms in acidosis, when carbon dioxide goes up and pH drops, all right? That means it's less breathing, all right? Suppression in breathing. It can lead to the disorientation and weakness, okay? So some of the causes are any kind of diseases of the lungs, like emphysema and pneumonia, bronchitis, where that effective gas diffusion, the normal diffusion of the gases, is inhibited because of that. Okay, um, or drug use, which can lead to lessening of the breathing, or a cardiac arrest, heart attack or a stroke, polio, or some kind of nervous system disorders. So how would this is from respiration, all right? So there's inadequate breathing, so inadequate elimination of carbon dioxide. So carbon dioxide is building up in the body, all right? And therefore there's a drop in pH. So how do you counter this, all right? You can counter this by infusing bicarbonate, all right? So giving an intravenous of bicarbonate, okay? So remember, if you again go back, if you increase the bicarbonate, what are you doing? You're pushing it back. You're pushing the equilibrium back, right? Because now that extra bicarbonate is going to grab all the H plus from the extra H3O plus and form the carbonic acid, which can then, of course, you can then eliminate that carbon dioxide through expiration, okay? All right. So infusion of bicarbonate can lessen the amount of H3O plus and therefore treat that respiratory acidosis. Suppose it's a metabolic acidosis, which is a condition of disease, all right? Then some of the symptoms are you're trying to breathe even harder, all right? You're fatigued, you're trying to breathe even harder. This acidosis is due to diseases of the kidneys, or like hepatitis or cirrhosis of the liver, um, and increased acid production, like in conditions of diabetes or hypothyroidism, alcoholism, or starvation, etc., or excessive loss of acid, okay, um, or loss of base, etc. Okay, so again, in this, because it's a disease, if it is something respiratory, it has to be addressed right away, and therefore bicarbonate is infused. If it's a disease, it's a long-term treatment, so sodium bicarbonate is also given, but orally, all right? Or you have to address the conditions of the disease by either, if it is diabetes, by insulin treatment, or dialysis for the renal failure, and so on. Okay. So those are the key differences. If it is a respiratory acidosis, it has to be taken care of right away, and therefore an infusion of bicarbonate is administered. If it is metabolic, then it's a gradual process, and the treatment is done orally with sodium bicarbonate. Okay, and then of course the conditions of the diseases are also addressed. Now, the other condition of respiratory alkalosis. In this case, what is happening is the reverse. Carbon dioxide goes down. If carbon dioxide goes down, that means the H3O plus is going to go down as well. All right. So if H3O plus goes down, the pH will increase. All right. So, what are the symptoms? There is it's increased breathing. All right. So the depth and the rate, it's kind of like a hyperventilation. All right. Instead of the hypoventilation, it's a hyperventilation, and that also other conditions are you become dizzy and lightheaded. That hyperventilation can be due to anxiety or hysteria, etc. Taking things that can cause that hyperventilation, drugs that can cause hyperventilation, or conditions like hypoxia, like the climbers that we talked about when we talked about equilibrium. All right, they have less oxygen because of the fact that less oxygen is available at altitudes, and therefore they're trying to breathe harder in order to overcompensate for the less oxygen available. All right. Okay. So that means again, too much of the carbon dioxide is getting eliminated. Carbon dioxide levels are going down, and therefore the pH is, because of the increased breathing, the pH goes up. Okay, so you want to bring down that state of anxiety. You want to calm the patient down. Sometimes they're given some oxygen mask, or else they're asked to breathe into a paper bag, etc. Okay. Now, metabolic alkalosis is different. That is because of the fact that um, you're losing the acid, all right? You're having conditions where, like in cases of vomiting or taking too much of alkali, which could be like over abusing antacids or something like that, or some kind of disease conditions where the acid H3O plus is going down. And when that happens, of course, the pH goes up. All right. Now, in these conditions, it's not due to breathing. All right. Again, breathing is going down. There is some kind of confusion. So the best thing to do is to treat those underlying conditions if it is something of the adrenal glands, to infuse saline solution into the patient to again rehydrate the patient, because if that patient has lost a lot of ions, etc., due to the vomiting and lost a lot of acid, etc., then you have to treat those conditions that caused that in the first place. Okay, so that summarizes the conditions of acidosis and alkalosis, what the symptoms are, what the causes are, and what the corresponding treatments are. Okay. And that is the end of this chapter, acids and bases. It's been a long chapter. However, if you break it down into its little sections, then it's easy to study it section by section. We first started out by just defining what acids and bases are, starting with Arrhenius and moving on to Bronsted and Lowry with the proton donor, proton acceptor concept. We looked at what strong and weak acids are, as well as strong and weak bases. 100% breakup is strong, less than 100% is weak. We derived the Ka expression, which always takes the forms of H3O plus times its conjugate base divided by acid concentration. And then using this Ka expression, we derive the expression for the self-ionization of water. And then from it, the pH. And then next we looked at how to find out acid concentrations through the titration method, and using the neutralization of acid and base, and then finally buffer and pH. So that's the end of chapter 11.